She Huru is an organization that is based in Mombasa. We work around coastal area but 001 to be specific. Na sisi tunafanya kazi na LBTQ-GNC persons in Mombasa and trans too, but trans men only.
There's one thing that has been clear during our activism work as She Huru, and we've had a lot of queer women who are either infected or affected by HIV, and they've not been able to get even just basic information on transmission, treatment, care and support that is available out there. So as an organization, we took it upon ourselves to try and at least do sensitization for our community. We had already begun that work a year before we saw the grant open. And when the grant opened, the motivation was, one of the questions that they were asking was, if you have a project that is already, has already started and you just need support to continue it, I would be happy to help. So we applied because we wanted to grow the project from beyond the myths to beyond the stigma, which was now working hand in hand with the community and also with the healthcare providers.
Accessing health nilile services is very difficult because you cannot just go to the hospital and wanze kusema, I'm a queer person and I want to be treated this way or that way. So She Huru tuliona hiyo gap and we decided to fill it.
Some of the problems we are solving as She Huru under this project is, for example, we've had a lot of our beneficiaries who came out with the issue of they are not able to access HIV and STI services in public facilities without being discriminated, without facing stigma. And that is one of the things that we saw it's important to solve with the project. So what we've been doing with the project is we've been going to these public facilities and sensitizing the healthcare providers so that they can able to give these services to the queer women who need these services without the stigma or the discrimination, because it is their constitutional right to access healthcare services without stigma and discrimination. So what we've done with the project is we've been able to train peer supporters, and then after that they've been running peer support groups at least monthly for any one of the community members, either if you're infected or affected, so you're able to access these support groups and meet other people and have communication about treatment, care and all the support services that you might need.
Hakuna project unaweza fanya in Kenya bila grants. Accessing the health services people, you need to have money to go to talk to them. You need to have this to do these little trainings. We need to have grants for people to come and sit down.
Since receiving the grant, I would say our biggest milestone has been we've always had an issue as the queer community of data, and when we go to the healthcare providers, the first meeting that we've had with the healthcare providers was there's no data to show that queer women really do need these services. So when we started the project, our biggest milestone is we've had queer women come out, and we've had queer women talk about their experiences in these healthcare facilities, and now towards the end of the project, we know that we now have the data that we might need to be able to engage the specific healthcare leaders that we need to, so that we have inclusive services for the queer women who are living with HIV or who are also affected by HIV.
I want to thank the AUEU for giving us this opportunity. It's a start of something. This is like a baby step for us, because now tuli get to touch some things that hatukuwa tunaweza kufanya. Before this is our first grants actually. Before we did it, tulikuwa tunafanya vitu online. So information yetu mingi iko online, iko based online. We were not reaching a lot of people. But since we got the grants, we touched some people. Tulienda huko kwa offices zao, we talked to them, we asked them to guide us and give us what are they called, the people from the ground, the ones wanaweza kuja wafundishe watu wetu ambao ni gender non-conforming, trans men, lesbians, bisexual and queer women. the community health workers came and they trained our Ninile. That's why we have the peer support group. So this grant imetusaidia because now we have a start. We have a start of something.
When we were applying for this grant, it was happening at one of those moments after we'd applied for different grants and we were not able to get, or sometimes you get, these applications are quite complex. And as a new organization, you don't stand a chance when there's a lot of complexities around application of the grant and even just getting to the threshold of qualifying for applying for the grant. But when we did apply for the AUEU, we got the grant, and I think for us that is saying that as a youth organization, it doesn't matter how young of an organization you think you are, you stand a better chance getting the AUEU Youth Lab Action Grant.
It matters a lot right now because now we are meeting a lot of queer youths. Hawa watoto wadogo wenye wamemaliza shule and they don't know anything about taking care of their health as queer people. You know, like CAT, everyone, we are all like human beings. Si kila mtu ako na knowledge. Now we are giving them knowledge yenye sisi tumepatiwa because of the AUEU grant. We are teaching them like how to take care of themselves. Yes, so basically the peer support groups works.
So something I would like to see more of is as a beneficiary of the representation grants, I would like to see more representation in these grants in terms of minority groups, underrepresented groups. And for example, I would like to speak for my community. I would like to see more of the LGBTQ persons and organizations represented under these grants.
Kuna vitu mingi sana hatujafanya, but if another organization comes and apply for the grants, we can continue working with them even if we don't have the grants. It should be something that inaweza kuendelea or inaweza anzisha something new. So it's really important for youth to apply for the grant.
In terms of sustainability, I think as She Huru, we've already done something about it as we began the project. And one of the things that we've done to ensure that we are able to sustain the work that we've been doing with Beyond the Stigma, even post the grant, is we have trained a lot of our peers. We've trained our peers to be able to give the peer-to-peer support. And as these monthly support groups are happening, the people attending the support groups are also able to learn from these peer supporters, so that even post the grant, we are able to continue having support within our community, because we already have these people trained and they're training others in the process of running these support groups.
What excites me the most is the things that we are going to add. We're still going to touch on. We're going to have a different category or something for mental health services. And She Huru, Sisi, we are known for resting and mental health. That is our best areas.
Being an AUEU Youth Lab grantee has given us this platform to interact with organizations from all over Africa and Europe, which is quite important to a growing organization like ours, giving us different perspectives of how we can impact our community, and learning from other people how they are impacting their communities, and seeing what we can borrow from them that can work in our context. What excites me about the future of our project is looking forward to the impact that we've already begun with this grant.
There are a lot of opportunities out here, and there are a lot of people that are going to hold your hands while doing this. So yes, just go outside and look for opportunities.